The number one question that we get asked from patients is, do I have to stay on GLP-1s forever? There is a huge fear that the moment that you stop weight loss treatment, the weight just snaps back. Today, we're getting honest about this question, the science of weight regain, and what the actual pathway looks like once you've hit your goal weight. This is Ask the Expert, the Weight Maintenance Edition. Joining me today to break down the data and biology of maintenance is our Chief Clinical Officer at Simple Online Pharmacy, Abdal Alvi. Abdal, you've seen thousands of patients' journeys, but why is it that the conversation always stops at weight loss and weight maintenance isn't really discussed?
I mean, weight loss is a lot more noticeable and measurable in patients and naturally gets the most amount of attention. But when it comes to maintenance phases, in a way, biologically, that's sort of patients entering the more harder phase, right?
Yeah.
Obesity has been considered for a long time now to be a chronic condition, a condition which can relapse. So I think the key question for patients isn't, do I stop? But rather, what's my long-term plan and goal?
Yep.
Because ultimately, that could involve dose adjustments. It certainly involves ongoing lifestyle changes. And of course, tying into the clinical support that we can offer here at Simple Online Pharmacy.
Amazing. So thanks for that introduction, Abdal. So let's start with our first question that we have. So do you have to stay on GLP-1s forever?
To be honest, the answer is, it depends. There isn't a limit for how long a person can take a GLP-1 medication, so technically you can take it indefinitely, including if you started at an appropriate weight and managed to get all the way down to a healthy BMI. To actually maintain at a healthy BMI would also be really appropriate. But I think some people do benefit from thinking about GLP-1s as long-term treatments. And of course, we want people to develop healthy habits, but ultimately we very commonly see kind of two pathways. Pathway number one is where patients try to take the medication for a period of time.
Yeah.
And while they do that, they try to build healthy habits and routines, and they increase the amount of protein and fiber that they're having, they improve their sleep, and come up with maybe more consistent movement. But unfortunately for a lot of people, just human biology means that it drives hunger, it drives cravings, and those don't disappear when you lose weight, despite developing those healthier habits. And so for some people, a really good option is to stay in a maintenance dose longer term, and that's particularly useful if they have tried to stop in the past and they've regained weight, if they maybe have an underlying medical condition, and that isn't dependency. I would term it to being similar to how a person takes blood pressure medications or medications for their cholesterol.
Amazing. So if we move on to our next question now, can you stop GLP-1s and maintain weight? So we know that you don't actually have to, but is it possible to do that?
Of course you can. But the key thing is that without the medication support, that can be a lot more difficult for patients. Look, a lot of our patients do stop the medication and they do manage to keep the weight off long term. And those tend to be the patients that have developed healthy habits, both in terms of their diet and in terms of their movement. And I think that is really important. But what's important to note is that it's really vital that a person reduces their doses gradually, that when they are prioritizing healthy eating, that they're increasing the amount of protein and fiber in their diet, and that they're eating really a nutrient-dense diet. That movement is vital, but particularly resistance training. But above all else, I would say that it's really vital to have a healthy attitude towards your weight.
Absolutely.
Don't focus on the scales, don't worry about slight increases, decreases. The key thing is about how you feel and, little things like how your clothes might fit better, for example.
Yeah, absolutely. That's something that we often advise our patients when they are speaking to us through your journey, is not to fixate on the numbers on the scale, because that can become obsessive as well in a way. So I think that's a better indicator, is about how you feel in your body and how your clothes are maybe fitting you, rather than weighing yourself too often than what you need to.
Absolutely. And that is the ultimate marker of health, isn't it? It's about feeling happy and comfortable in yourself.
Absolutely. Thanks, Abdal. So our next question is, what happens when you stop weight loss injections? So what's the first month looking like when you come off a treatment like this? So what happens to your body?
And this is a big concern for patients, isn't it? Because people know that these medications, once you stop them, that your weight can rebound and can come back. The key thing to remember, though, is the medications don't stop working overnight.
Yep.
Your body builds up a reserve of the medication, and for some time the medication will continue to have an effect. However, as the medication does leave your system, naturally your hunger is going to come back between meals, which will mean that your portions might start to creep up, and those cravings, that sort of food noise starts to get louder again. And people start to notice little things like, for example, the scales might show that their weight has gone up slightly soon after stopping the medications. Again, that's nothing to worry about. That could just be changes in kind of the water in your body or changes in food volume. It's not necessarily fat gain.
Yeah.
The important thing is, don't panic. Look, we would expect in those circumstances appetite to rebound. But again, this is all about a planned transition, right, to maintenance. It's about regular meals, it's about protein, it's about fibre, it's about hydration, it's sticking to a movement plan that you can really adhere to. And of course, the reasons for stopping medication can also range vastly amongst patients. And the key thing is, if you're experiencing side effects, or if you're concerned about anything, if you're even worried about cost, if you're worried about planning for pregnancy, please do contact our team and we'd be more than happy to help.
Absolutely. Thanks for that, Abdal. So if we move on now to our next question, why do people regain weight after stopping a GLP-1? So we've seen some reports, such as the Oxford report, which says that regain is likely, but biologically, why does that happen?
And I think the key thing that you've said there is biologically, because that's what it is, and people need to realise that. And if they don't realise that, sometimes people think that they're doing something wrong. That's not necessarily the case. Or, others might think that they don't have the willpower, for example. Look, when a person loses weight, the body responds in a number of ways. It increases hunger signals. You start to feel less full. You become more energy efficient. What GLP-1 medicines do is that they reduce hunger and cravings. Now, when you're going to remove that support, then obviously the food noise can potentially come back. The other thing to keep in mind is that when you're lighter and you have lost weight, you need less calories day to day. And so if your intake goes back to what it was previously, then clearly weight gain is going to happen and start to happen gradually without seeming overly obvious. And that's why I think maintenance is really its own phase of care.
Yep.
And it's important to think about it holistically, not in terms of just medication, but also in terms of appetites, building healthy routines, and of course preserving muscle as well, not just through protein intake, but also through some sort of resistance training.
If we move on now to our next question, how long should GLP-1s be used? So is there a gold standard timeline for how long a person should be taking a treatment like this?
There's a very common misconception that GLP-1s can only be taken for a short amount of time. And that's not actually the case. GLP-1s can be taken over the long term. And for some people, that's appropriate. And for others, it's a shorter duration. They can even be used beyond 2 years. Again, there's a misconception that they can only be used for 2, but that's not actually the case. The key thing is always check in with our clinical team. On every assessment, we want to know about, are you losing weight? What are the positive effects or the side effects manageable for you as well? And I think depending on that, a person's treatment plan can be tweaked. They can go up a dose, they can choose to maintain, you can even go down a dose. The key thing is that it's personal to that individual, and every weight loss journey is indeed very different.
Yeah, absolutely. It's very unique. There's no two patients' journeys who are the same. So I think a lot of patients just need to give themselves that little bit of grace to know that you can't compare your journey to your friends or your families, because what one person's experience is not necessarily going to be the same as yours. So that's a really important point that you've covered there. So we'll move over to our next question, and that is, can a GLP-1 be used long term? So if someone decides that they need to stay on this treatment, is that medically safe?
The quick answer to that is yes, GLP-1s can be used in the long term, and that ties in very directly to the understanding of obesity as a chronic health condition. There's not really any evidence currently to suggest that long-term use is unsafe in any way. And And of course, when it comes to patients getting through that initial phase where they tend to lose weight fairly quickly, then maintenance in the long term becomes really vital for patients as well. More than that, what's really interesting is that even during those maintenance phases, there's now evidence to suggest, such as a trial that was done for Wegovy, a very commonly used GLP-1 medication. It was called the SELECT trial, and it actually found that there was about a 20% reduction in major heart events that can happen with patients that are living with obesity or that are overweight, who might have had a cardiovascular event in the past. And that was independent of weight loss. So it shows that not only is it good for helping you lose weight and also maintaining the weight loss, but it's also really good for things like heart health as well.
Yeah, and who knows what else it's going to be useful for in terms of supporting your health and other means in the future. So it's really interesting to hear that.
Absolutely. And you know, these studies to explore the benefits of these medications for a wide range of health conditions are ongoing. And wherever we can help our patients, we certainly will.
Absolutely. So our next question that we get asked is, what are the long-term side effects of GLP-1 injections? So beyond the usual stomach issues that some patients might experience, what should patients watch out for if they're using this for the long haul?
So coming back to some of those more common side effects, things like nausea and constipation and diarrhea, this is what we would term to be gastrointestinal side effects. And for the majority of patients, they're manageable. And they tend to pass with time. You know, your body starts to get used to the medications. They tend not to bother people anymore. And of course, if that's not the case for any of our patients, they should contact our clinical team. In the longer term, patients should certainly be watching out for things like pancreatitis. Now, pancreatitis is very uncommon, but it is serious. If a person's got any kind of a severe, persistent tummy pain, they've got vomiting, they've got any kind of discomfort that radiates to the back, they really need to have urgent medical advice. They should stop the medication and they should speak to either our clinical team, and if our clinical team is not available, such as, for example, in the evening or overnight, then they should seek more urgent medical attention.
Thanks for that explanation, Abdal. So once a patient has reached their weight goal, what is the standard maintenance procedure?
So there isn't necessarily one strict protocol that can be followed because every individual patient naturally responds differently to treatment. I think the principle generally tends to be that a person should try to maintain on the lowest effective dose that helps them not only keep that weight stability, but also gives them a good level of appetite control while balancing up the fact that side effects or any potential side effects are manageable. So if somebody is stable, they can stay in the same dose. But I would also say that if they're losing weight too quickly, or they're maybe not even eating enough, dose titrations become really important. And of course, if the hunger comes roaring back and, a person's weight starts to rise steadily, then the dose can be stepped up as well. So maintaining on the lowest dose that offers that stability is really vital.
Amazing. So it's just more the patient's journey is based on how they're feeling and how they're finding the strength that they're on, and then it's just dependent on side effects, how much appetite suppression that they're having, and if they're getting the results. If that's weight maintenance, then that's great.
Absolutely. And again, it's all about the individual patient and their own personal journey and weight goals.
So we'll move on to our next question. When should I move to a maintenance dose?
Again, I think it's important to not consider a maintenance phase as being something that you've seen on your scales, for example. I think it's all about a decision that's based on stability. And that stability can be that you're maybe at a healthy weight range, or you've reached your target weight goal, which doesn't necessarily, by the way, have to be a healthy BMI. A person's target can be what suits them as part of their weight loss journey. And of course, at the same time, that they've got a diet and exercise routine that they feel that they can maintain as well. If a person is experiencing any issues with their medication, such as side effects like nausea or constipation, or if they feel even that the medication is working too well and the appetite is overly suppressed, we can even recommend maintaining at a current dose, at a reduced dose. Ultimately, it all comes down to stability.
So we'll move on now to our next question. Can I reduce my dose after reaching my target weight?
The quick answer to that is yes. I mean, dose reductions can sometimes be considered and can be appropriate, but again, it's important to frame that properly. What GLP-1 medications do is that they aim to treat what is a chronic condition. And so when a person reduces the medication, or if they stop the medication, then that biological drive that your body has to regain weight can come back. And for some patients, long-term maintenance as a result does require ongoing treatment, but at a therapeutic dose. And if a person does step down, I would suggest that it should be gradual and should certainly be monitored as well. And when you do move down to the lower dose, give it a few weeks, maybe possibly even a few months. And of course, don't look at the scales. Look at how you're feeling in terms of your hunger between meals, your cravings that you're feeling. Certainly keep an eye on your portion sizes and how manageable it all feels for you. And of course, if your appetite then increases or your weight starts to trend up even gradually, then maybe the reduction was too much. So the priority is not to reduce and stop at all costs. It's all about protecting your health and the weight stability that you've managed to achieve.
We'll move on now to our next question. What is microdosing GLP-1 for maintenance? So we see this term microdosing trending on social media quite a lot. What is that, and is it safe?
So microdosing happens when patients try to, for cost or for whatever other reasons, to take smaller sort of non-standard doses and try to stretch their pens out longer than what they're supposed to be used. Microdosing isn't safe, and it's not something that we would recommend. And using a dose that's lower than what was intended for you, or to increase the time period within which you're using the medication, isn't something that's been tested. And when people start to count clicks, you don't really know the dose that's been administered. So we would argue that it's not safe and that patients shouldn't do it. The other thing that patients need to keep in mind is that for Mounjaro, you can use the pen for up to 30 days after you've first used it, and for Wegovy up to 6 weeks. And of course, by microdosing and by increasing the pen duration, quite often patients go out with that time period. And that can increase your risk of side effects, and we don't know if you're actually getting your full dose. So it's not something that we would recommend. It's always best to stick to the licensed indications for using any of these medications.
Thanks for that explanation, Abdal. So we'll move over now to our next question. Is medical supervision needed for maintenance? So some patients often ask, can I do it alone once I've got to my target weight?
And that's absolutely fine if a patient feels comfortable in doing so, but I probably wouldn't recommend it. And it's not because patients are incapable of making those decisions, but it's actually because the maintenance part is where, your body starts to push back. And of course, our clinical team is here to support patients with maintaining their weight loss wins. We know that from research that when GLP-1 support is removed, that people can regain weight, even if some of the lifestyle measures that they've put into place are ones that they're still following through with. And that is a reminder that this is biology. It's not just behaviour. And of course, supervision doesn't mean that we're going to constantly check up on the patients. The point is that we can help people to make small, sensible, manageable adjustments. And that can be around not just their dosage, but around their nutrition, their protein intake, around any strength training that they might be doing, around, side effects, or even just confidence when it comes to eating patterns. So yeah, absolutely. Patients can do the day-to-day work, but you shouldn't feel that you have to do it unsupported. We've got a broad range of clinical support mechanisms and content that people can tap into. And I think it's important to note that maintenance maintenance is a phase of care. It's not the end of the care that we are able to provide.
Amazing. So I think it's really important what you've just touched on, that there's support, and I think that's ultimately what it is. It's support for the patient when they're at this part of their journey when it comes to weight maintenance. A lot of patients are aware that we are supporting them through the weight loss part, but they're maybe just not aware that we're actually there to support you at the next step as well when you're just looking to maintain the goal that you've got to.
Yeah, absolutely.
Thank you so much for that, Abdal. Our next question is, why have I stopped losing weight on my GLP-1? So some patients can feel like it's frustrating when the scale stops moving. Why does that happen?
I think hitting a plateau can be frustrating for any patient, particularly when, as we see in a lot of our patients, when they first start using the medication, they tend to lose a lot of weight pretty quickly. And so when you do hit a plateau, you start to worry, is the medication still working for me? Particularly if you've titrated up the doses and that you've reached close to the maximum dose. But again, that's perfectly normal, and it's part of a normal weight loss and weight management journey. And of course, it just is a result of when your body's adapting to new routines or to lifestyle changes. I would say that the person should first check the basics. Are they taking the dose correctly? Are they using it consistently? Are they storing it properly? Have they titrated upwards appropriately as well? And then look at the behaviours that can start to creep in over time when it comes to portion sizes, when it comes to, grazing between meals, when it comes to taking fewer steps or having less protein intake, or kind of introducing some weekend calories. Small and realistic adjustments to a person's lifestyle are really, really important. And, the biggest mistake is to chase rapid weight loss forever. The aim isn't that. The aim is to make sustainable changes to your weight loss journey, and doing so while preserving, other aspects of your health, such as preserving muscle and looking really beyond the scales.
Amazing. So I think the key thing is you have to look beyond just the medication. It's the lifestyle changes as well in order to support everything else.
Absolutely.
Amazing. Thank you. So our next question that we have is, does GLP-1 work without changing your diet?
I mean, a person can lose weight on GLP-1 medications even if their diet isn't perfect, because, appetite is reduced and portion sizes naturally become a lot smaller. But I would say that the quality of that weight loss and how well you feel as a result really depends heavily on what you're eating. And if your diet quality is poor and, you're not taking in enough protein or fibre or any key nutrients such as iron, vitamin B12, and calcium, that can naturally lead to fatigue. It can lead to muscle loss. It can lead to constipation. And it makes that long-term maintenance considerably harder for patients. So it's not that these are magic injections that, will replace nutrition. Rather, people should see them as a tool that makes healthy, easy eating a lot easier for them. And, we advise people to keep it simple. Prioritize protein to protect your muscle, increase your fibre intake, limit the amount of ultra-processed foods that you're having, and of course stay really well hydrated as well. And that will turn any kind of short-term weight loss into really sustainable long-term health improvements.
So our next question that we have is, what happens if you don't exercise on a GLP-1?
Well, with any weight loss, some loss can actually be muscle and not just fat. So if you're not doing resistance training and you're not eating enough protein and having enough protein in your diet, then you can actually start to lose more muscle than you need to and that you should be. And of course, muscles are really important for not only strength and balance and kind of general metabolic health, but also for long-term maintenance ultimately. And sometimes people focus only on appetite suppression and they forget all about movement. So look, it doesn't mean that you need to become a gym person overnight, but you do need to have some sort of progressive resistance training. Now that could be in the form of working out in the house. It could be using resistance bands, some sort of machine at the gym, kind of just moving is really vital. And that could include just regular walking as a starting point. So exercise has got a number of benefits for a person's general health as well. But if you're asking the question, will they work without exercise? The answer is yes, but it's better to be introducing movement as part of your longer term lifestyle regime.
And it doesn't need to be anything too difficult. They can make small, like manageable changes. So if you just started maybe introducing more steps and then moving on to something like workouts at home. So again, I think the key is our patients should feel that they don't need to become gymaholics and are going all the time, but it's small manageable changes, as with diet is as well.
I think that's absolutely the key thing, which is do what you feel comfortable with and start to introduce movement and then start to build up on that. And again, that will enable you to have longer term lifestyle habits that are going to really help you in your weight loss and weight management journey.
Okay, perfect. We'll move over now to our next question, which is, and I think this is our last question, what are the alternatives to a GLP-1 for weight loss?
GLP-1s have been getting a lot of the headlines recently and are certainly a big topic of conversation. And the reason for that is because they work so effectively. And for the majority of patients, they tend to work very safely for them as well. Having said that, there are a number of other options that can be pursued. And again, it's really important for a person to tie in with either our clinical team or their own clinical care provider to discuss those options in more length. One medicated option that people may be familiar with is Orlistat. Orlistat works in a considerably different way to the GLP-1 medications. It actually binds to the fat that you take in your meals and in your diet. And by being a fat binder, you take this oral pill 3 times a day. You can take it with food, and it can be appropriate for some patients. There's also obviously structured weight management programs. These can focus on nutrition and habits and making those long-term changes, and sometimes those are available in the NHS, but availability unfortunately can depend on where you live, and sometimes the waiting list can be fairly long as well. And of course, for patients that are living with severe obesity or with a number of complications, then bariatric surgery can be a really effective measure as well. The key message is that, look, there's always options for patients, there's always next steps, and patients don't need to feel as though they're having to figure it out alone. We're genuinely here to help.
Thanks for that, Abdal. Maintenance isn't the end of your journey. It's just a new phase of care. If you found these clinical insights helpful, please press the like button and subscribe to our channel. It really helps keep us bringing experts like Abdal on to answer your questions. If there's a specific part of your weight care journey that you want us to cover next, let us know in the comments below. We'll see you in the next episode.